Okay, go.
All right, so my name is Jocelyn Peters, and I will be performing my physical assessment. Um, starting my initially, I will walk in the patient's room, explaining to him the procedure that we are going to be doing. So, hey, my name is Jocelyn. I'll be your nurse today. I will be performing a physical assessment on you. I need to ask you a couple of questions. Can you tell me your name and date of birth? Can you tell me what brought you into the hospital? Can you tell me what hospital you're in? And can you tell me who's the president? When those questions are answered correctly, he is alert and oriented. I will be performing your physical assessment, and we're going to start with your head. First, I will start with hand hygiene. Then I would look and inspect his scalp to make sure that there's no skin breakdown. Then I would palpate to make sure I don't feel any masses. While I'm palpating, I'm going to go ahead and touch his sinuses, checking to see if there's any pain. Then I'm going to test his cranial nerve 5, have him to clench his teeth real hard, and as he's clenching his teeth, I will feel for his temporomandibular joints. Then I will test for cranial nerve 7, and those are my facial expressions. So I will have him smile real big, make a frown, and close his eyes tightly. Then I am going to inspect his nose. So I'm going to look up each nair, make sure everything is pink. Okay, then I'm going to inspect his mouth, looking at teeth, cheeks, tongues. And then now that I'm using my pen light, I'm gonna go ahead and inspect the ears. So I'll pull up, okay. On this side and inspect the ears. Now I will test his cranial nerves 3, 4, and 6 for any extraocular movements. So I would instruct him to look straight ahead, and I will move my pen light to check and see if there's any extra movements. Then I will inspect his eyes, looking at the conjunctiva, sclera, pupils, making sure pupils are round. Then I would move down to the neck. I would inspect the neck, make sure there's no masses or lymph nodes. Then I would test his mobility and have him put his head down, look left and right. I will palpate his trachea. While I'm here, I will also check his carotid pulses one at a time. And then I would listen to his carotid. Next, I'm going to move on to his chest. I'm going to inspect his chest, see how his chest is rising and falling when he breathes. Then I am going to listen to his lung sounds and heart sounds. Then I will move on to my heart sounds. Then I would move to his upper extremities, inspect both arms, making sure that there's no skin breakdown. I would test his range of motions and have him bend his arms at the elbows. I'm gonna check both brachial pulses, check radial pulses. Then I'm gonna check capillary refill. For strength, I would have him squeeze both fingers. I would have him pull me to him, and then I would ask him for resistance, like me pulling him, but he doesn't let me. Then I'm going to move on to the abdomen. I'm going to inspect the abdomen first, then listen to abdominal sounds in all 4 quadrants. Then I would lightly palpate in all 4 quadrants. Then I would do a deep palpitation. And I would come over here and palpate the liver. I would also ask patient how often is he going to the restroom? Is it normal for him? Is he constipated? Then I would move to his lower extremities. I would have the patient stand up, walk on his heels. I would ask him to bend down, touch his toes. I would also assess his pulses, popliteal, and dorsalis pubis. I would also check capillary refill. I would also have him take 1 foot and run it down his calf. Run it down his shin, and then I would ask him to take the other foot and run it down his shin. Now I'm going to do my education. I did my education on obesity. Obesity is defined by the BMI being greater than 30 kilograms per meter. Patients who obesity is a result of excessive consumption of food. More than half of the adults in the U.S. are overweight or obese. Conditions and risk factors. Stress can be a risk factor. You can have stress eating, family history, hormonal balances, eating disorders. The obvious symptom of being obese is having a large abdomen. The degree of obesity can be assessed by obtaining a patient's body weight, height, and waist measurements. Also, another risk is being on antipsychotic medications. To treat obesity, we would like the patients to exercise 3 to 5 times a week, 30 minutes a day. We would also want the patient to be on a calorie restricted diet. Even though we want the patient to lose weight, losing 1 to 2 pounds a week is healthy. For treatment, patients should be educated about maintaining a healthy weight, as well as supporting them for these life changes. Patients who are severely obese, they could be a candidate for bariatric surgery. To prevent obesity, we will want the patients to choose healthier food times, healthier food choices, limit sit time activities, and participate in regular physical activities. There are outside sources like groups that patients can participate on. One program is the JOG program. It is a large community-based program that starts focus on changing patients' unhealthy behaviors. They have a personal support team that are staffed with advisors and coaches. They have ready-made communications and materials. And they also have sessions where they reach out and to check on the patient's progress.